Hi, my name is Christina and I'm a physician assistant student. Physician assistants are licensed clinicians who practice medicine in every specialty and setting. They can diagnose illnesses, develop and manage treatment plans, prescribe medications, and may serve as a primary care provider. They are dedicated to expanding access to care and making healthcare more accessible. For my capstone project, I was asked to focus on an objective in Healthy People 2030. The mission of Healthy People 2030 is to promote, strengthen, and evaluate the nation's efforts to improve the health and well-being of all people. One of the objectives of Healthy People 2030 that resonated with me was to increase the proportion of people who discuss interventions to prevent cancer with their providers. Cancer is one of the leading causes of death worldwide and has affected most people in some way. It is such a prevalent disease, but not enough people are educated about ways to reduce their risk. It is important to me specifically because I have had family members affected by cancer, like I'm sure many of you have as well. I always wonder if there was something that they or myself could have done to prevent cancer. Now that I have done some research, I know that there are things that can be done to lower a person's risk of getting such a serious diagnosis. That being said, the aim of this presentation is to educate people about interventions such as screenings and risk factor modification so that they can further discuss these with their providers and reduce their risk of cancer and cancer-related death. At the end of this presentation, I hope that you will understand what cancer screenings are available, know how often you should undergo screenings, and also be able to identify cancer risk factors as well as understand ways to lower your risk of developing cancer. So everyone knows what the word cancer means, but not many people understand what cancer actually is. Cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. This can start almost anywhere within the human body. Normal human cells grow and multiply to form new cells as the body needs them. Sometimes this orderly process breaks down, and abnormal or damaged cells grow and multiply when they shouldn't. These cells may form tumors, which are lumps of tissue. These tumors can be cancerous or not cancerous. Cancerous tumors spread into or invade nearby tissues and can travel to distant places in the body to form new tumors. So, what causes all of this to happen? Well, cancer is a genetic disease, which means it is caused by changes to genes that control the way our cells function. Genetic changes that cause cancer can happen because of errors that occur as cells divide, because of damage to DNA caused by harmful substances in the environment, such as chemicals in tobacco smoke and UV rays from the sun, or simply from inheritance. I briefly mentioned harmful substances like the chemicals in tobacco smoke and UV rays from the sun. But what are some other cancer risk factors? Well, there are many risk factors associated with cancer. Some well-known risk factors for cancer include age, alcohol, chronic inflammation, diet, hormones, tobacco, immunosuppression, obesity, radiation, and sunlight. It is important that we know these risk factors because modifying them may reduce the chance of developing cancer. Of course, there are some risk factors that are non-modifiable. For example, advancing age is the most important risk factor for cancer overall and for many individual cancer types. Although I'm sure many of you wish you could make yourselves younger, unfortunately we don't have that kind of technology yet. However, it is important to be aware of the fact that the median age of cancer diagnosis is 66 years old. This means that as you get older, it is more and more important to discuss cancer prevention with your medical provider. Drinking alcohol can increase your risk of cancer of the mouth, throat, esophagus, larynx, liver, and breast. The more you drink, the higher your risk. For those of you drinkers who are smokers as well, risk of cancer is much higher for those who drink alcohol and also use tobacco. That being said, if you drink, do so in moderate amounts. Chronic inflammation is another cancer risk factor. In chronic inflammation, the inflammatory process may begin even if there is no injury, and it does not end when it should. Chronic inflammation may be caused by infections that don't go away, abnormal immune reactions to normal tissues, or conditions such as obesity. Over time, chronic inflammation can cause DNA damage and lead to cancer. According to the American Cancer Society, about 1 in 5 cancers in the U.S. and about 1 in 6 cancer deaths can be linked to poor nutrition, being overweight, not exercising, or alcohol. People with obesity may have an increased risk of several types of cancer, including cancers of the breast, colon, rectum, endometrium, esophagus, kidney, pancreas, and gallbladder. Conversely, eating a healthy diet, being physically active, and keeping a healthy weight may help reduce the risk of some of these cancers. Hormones also play a major role in the development of cancer. For my women out there, estrogens are known human carcinogens. For instance, taking combined menopausal hormone therapy, such as estrogen plus progesterone, can increase a woman's risk of breast cancer. Menopausal hormone therapy with estrogen alone increases the risk of endometrial cancer and is used only in women who have had a hysterectomy. A woman's risk of breast cancer is related to the estrogen and progesterone made by her ovaries. Being exposed for a long time and or for too high of these hormones has been linked to an increased risk of breast cancer. Increases in exposure can be caused by starting menstruation early, going through menopause late, being older at first pregnancy, and never having given birth. Conversely, having given birth is a protective factor for breast cancer. As much as we all love a good tan, sun exposure is another big cancer risk factor. The sun, sun lamps, and tanning booths all give off ultraviolet radiation, or UV. Exposure to UV radiation causes early aging of the skin and damage that can lead to skin cancer. Now for the heavy hitter, tobacco. Tobacco use is a leading cause of cancer and of death from cancer. People who use tobacco products or who are regularly around secondhand smoke have an increased risk of cancer because tobacco products and secondhand smoke have many chemicals that damage DNA. Now, after learning all of this, I bet you're thinking, well, what is my risk of developing cancer? Well, fortunately for you, the Ontario Cancer Centre offers online risk assessment quizzes to determine your risks. They have risk assessments available for the following cancers: breast cancer, cervical cancer, colorectal cancer, kidney cancer, lung cancer, and melanoma. I highly encourage all of you to check out this website and take some of these risk assessments. All of the quizzes are quick, simple to take, and informational. The link to this website will be in the description of this video. So you might be wondering, how does all of this relate to you? And why should you be worried about cancer at all? Well, in 2020, it was estimated that 1,806,590 new cases of cancer would be diagnosed in the United States, and 606,520 people would die from the disease. In Florida alone, there will be an estimated 152,600 new cases of cancer and 47,540 cancer deaths in 2022. That is a lot of people being diagnosed with and dying with cancer. But as I mentioned previously, cancer is a disease of the aging. In 2018, the rate of new cancer showed a significant spike in the rate for adults aged 45 to 85. That is why this presentation is geared towards adults aged 45 and up. And remember all those risk factors that I talked about earlier? Well, around 1/3 of deaths from cancer are due to the 5 leading behavioral and dietary risks, which are high body mass index, low fruit and vegetable intake, lack of physical activity, tobacco use, and alcohol use. So as important as it is to assess and modify your cancer risk factors, there is another incredibly important aspect of cancer prevention: screening. We are so lucky to have so many amazing screening tools at our disposal. Early detection is the key to preventing cancer and cancer-related deaths. Because screening is so important, I wanted to collect some data from the public to see how much they know about cancer screening, as well as how often they are undergoing screening. I collected information from adults aged 45 and up to learn what this demographic is doing in terms of cancer prevention. 74 people completed the survey. I asked questions regarding age and gender, as well as if they have ever discussed cancer prevention with their provider, if they have ever been diagnosed with cancer, at what age they think the recommendations are to start screenings, and how often they should get screened for breast, cervical, prostate, skin, lung, and colorectal cancer, and how often they actually get screened for these cancers. Over half of those that participated in the survey, or 53%, had never discussed cancer prevention with their provider. This figure was striking to me, and I believe it really highlights the importance of the Healthy People 2030 objective to increase the number of people who discuss cancer prevention with their provider. 12 of the 74 participants, so 16%, had been diagnosed with cancer. Of those 12 that had been diagnosed with cancer, 6 of them, so 50%, had never been screened for at least one of the types of cancers that I polled about. Again, this was another striking figure to me. I would have thought that those who had received a previous cancer diagnosis would be more likely to receive all applicable screenings. Of the 74 participants, only 20, so 27%, had been screened for all of the applicable screenings that I polled on. The remaining 54 participants had not been screened for an average of 1.85 of the applicable cancers I polled on. So that means that most participants are forgoing anywhere from 1 to 2 applicable screenings. Of the types of cancer screenings polled on, participants were most likely to get breast cancer screenings as often as they thought they should, so 77%, and least likely to get prostate cancer screenings as often as they thought they should, which was 25%. When asked to identify the starting ages for applicable screenings, participants were only able to select the correct starting age 27% of the time. It's important to know when screenings are supposed to begin so you're able to stay on track with all of the recommendations. This figure shows that clearly there is room for improvement. In this chart, the blue bars represent individuals who are getting screened as often as they think they should. The orange bars are not. Therefore, there is a large percent of people in this demographic who are not getting screenings as often as they think they should, meaning they are potentially neglecting this vital step in health maintenance. One of the biggest takeaways from this is that women are getting their gender-specific screenings more often than men. All that being said, there are still a lot of people who are not well informed about cancer screenings, and this population is who screenings are most important for. So I'm now going to take some time to teach you about some of the available screenings and the guidelines for when these screenings should be done. To start off, we'll talk about screenings that are specific to women only, starting with breast cancer. Breast cancer is the leading cause of cancer-related death in women, second to lung cancer. Early detection is vital when it comes to breast cancer, which is why screening mammograms are recommended. But just how often should you be getting a mammogram? Well, it depends. For a woman aged 40 to 49, the decision to start screening with mammography prior to age 50 should be an individual one. Women who place a higher value on the potential benefit than the potential harms may choose to begin screening once every 2 years between the ages of 40 and 49 years. For women aged 50 to 74 years, the United States Preventive Services Task Force recommends biennial screening mammography for women aged 50 to 74 years. So, if you're between the ages of 50 and 74, you should absolutely be getting a screening mammogram every other year. However, the data I collected about breast cancer screening showed me that a large number of women actually get screening mammograms every year, and that many of them think screening should start at age 40. This is because most providers will recommend annual breast cancer screenings starting at this age. And even better, most insurances will cover a mammogram once a year. So even though the guidelines say every 2 years, and the specific recommendation isn't until age 50, it never hurts to be extra cautious, and there are minimal downsides to annual screenings. So if you're between these ages and are already getting yearly mammograms, keep it up. And if you're not, then it's time to get started. Our next female-specific cancer screening is cervical cancer. Cervical cancer screening is done via Pap smear. The recommended age for initiation of Pap smears for cervical cancer screening is 21. For women aged 21 to 65, the United States Preventive Services Task Force recommends screening for cervical cancer every 3 years with cervical cytology alone in women aged 21 to 29 years. For women aged 30 to 65 years, the recommendation is for screening every 3 years with cervical cytology alone, and every 5 years with high-risk human papillomavirus testing alone, or every 5 years with high-risk HPV testing in combination with cytology, or co-testing. Now, that's a lot of technical information, but to simplify it for you, most Pap smears will cover screening for both cervical cancer and for HPV. So for the average risk woman, you can plan to get a Pap smear every 3 years until you're 65. As you age, the risk of cervical cancer decreases, so Pap smears are not recommended after the age of 65. So next will be a male-specific screening, which is for prostate cancer. For men aged 55 to 69 years, the decision to undergo periodic prostate-specific antigen-based screening for prostate cancer should be an individual one. Before deciding whether to be screened, men should have an opportunity to discuss the potential benefits and harms of screening with their clinician and to incorporate their values and preferences in the decision. Though there are no specific recommendations for prostate cancer screening frequency, it is important to discuss the screening options available with your provider. Now on to screenings for everyone. The biggest one is colorectal cancer. The United States Preventive Services Task Force recommends screening for colorectal cancer in all adults aged 50 to 75 years. The gold standard for colorectal cancer screening is a colonoscopy. This is the absolute best screening method for detecting colorectal cancer. Detecting and removing polyps through colonoscopy is critical to colon cancer prevention. Now, some of you may have heard of Cologuard, which is an alternative to colonoscopy. And I'm sure others of you are saying, there's an alternative? While there is an alternative, it is not considered gold standard for a reason. Cologuard can detect the colorectal cancer associated DNA markers and the presence of blood in human stool. So essentially, it can just tell us whether or not cancer is there, whereas a colonoscopy can identify and take care of polyps before they can become cancerous. Cologuard is not recommended for individuals who are at high risk for colorectal cancer, such as those with a family history of colorectal cancer. Those who do use Cologuard as their method of screening for colorectal cancer must do so every 3 years. Colonoscopies are typically good for 10 years, which is a really long time to not have to think about a screening. However, again, depending on family history or on the results of your previous colonoscopies, your provider may recommend more frequent screenings. On to skin cancer. Skin cancer screening is difficult because there are really no set guidelines for how often you should be screened for skin cancer. However, exams by your doctors and checking your own skin frequently can help find many skin cancers early when they are easier to treat. Regular skin exams are especially important for people who are at higher risk for skin cancer. Risk factors for skin cancer include a history of melanoma, a family history of melanoma, light skin, blonde or red hair, more than 40 moles, 2 or more atypical moles, many freckles, severely sun-damaged skin, a history of blistering or peeling sunburns, and a history of indoor tanning. That being said, if you fall into one of these categories, it is very important that both you and your doctor are checking your skin regularly. Many doctors do recommend that older individuals see a dermatologist annually for a full body skin check. The last screening we will talk about today is lung cancer screening. Annual lung cancer screening is recommended for adults aged 50 to 80 years who have a 20-pack year smoking history and currently smoke or have quit within the past 15 years. Screening is done via a low-dose computed tomography scan. Screening should be discontinued once a person has not smoked for 15 years or develops a health problem that substantially limits life expectancy or the ability or willingness to have curative lung surgery. So I've thrown a lot of information at you today, so let's sum up what we have discussed. We talked about what cancer is and how it develops. We've discussed risk factors for cancer and ways to modify those risk factors. And we talked about available cancer screenings, when those cancer screenings should begin, and how often the screenings should be done. In teaching you about all of those topics, I hope I have achieved some of my goals for change and awareness. These goals include increasing the number of individuals who discuss cancer prevention with their providers, raising awareness about the potential risk factors and the modifiability of these risk factors, and raising awareness about what cancer screenings are available and when they should be done. So I figured I would give you some of my own recommendations for your cancer prevention journey, the first of which being discuss cancer prevention with your provider. If you've learned anything from this, I hope it's that you should be having discussions with your provider about cancer screening, cancer prevention, risk factors, all of that we discussed. Most cancer screenings do require an order from your primary care provider, so they are a great starting point to get your cancer screenings in order. You can also go ahead and get yourself a calendar just for your medical appointments. It can be really hard to keep track of all of your appointments and when and how often you should be going for your screenings. Keeping track of your appointments and when your screenings are due through something like a calendar might make it easier for you to get to those important screenings. Another point is just to remember that doing all of these things won't necessarily stop you from getting cancer. Unfortunately, at the end of the day, all of the risk factor modification and screening in the world might not be enough to prevent you from getting a cancer diagnosis. The hope is that it will reduce the risk. Also, don't neglect your screenings. Don't think that just because you feel good means that you don't have to get your screenings done. That is the point of these screenings, to catch things before they become a problem. Even if you're feeling totally healthy, make sure that you still follow screening guidelines. If you are interested in learning even more about cancer, there are plenty of resources available to you. Many of these sites are dedicated to helping people who face cancer. Through these organizations, you can learn about cancer research, patient services, early detection, treatment, and education. Some great informational sites are the American Cancer Society, the National Cancer Institute, and the Centers for Disease Control and Prevention. And then that Ontario Cancer Center that I previously mentioned has those risk assessment quizzes available. I hope you have learned something today and feel better equipped to protect yourself against cancer. Remember that you can always speak to your provider further about cancer prevention. Thank you for taking the time to listen and learn, and a special thank you to those who participated in my survey. Stay healthy and be well.